Okay, well, I had almost 10 minutes worth of this section done when I got a phone call. Of course, the phone call pops up on my screen, and so I decided, oh, I'll just try to trim that out. Yeah, I trimmed everything else out, so I get to do this section over again. I'm going to start with some causes of hypopituitarism. The most common cause is going to be a pituitary tumor that damages the pituitary gland, and then its hormones are not properly secreted. Also, there can be autoimmune disorders that destroy the pituitary gland, sometimes infection, infarctions, could occur if someone goes into shock. The most common cause of a pituitary infarction is postpartum hemorrhage, also known as Sheehan syndrome. And that's because the pituitary gland enlarges during pregnancy, and then if the patient becomes hypotensive with hemorrhage, for example, the gland can become hypotic and necrotic. Interesting thing about Sheehan syndrome is that the damage may not manifest itself for many years. There may be enough pituitary function for the patient to, traipse along for a long time, and then suddenly, sometime later they become hypopituitaric. Some other things would be things that destroy the gland, like a surgical procedure. You're trying to take a tumor out and the gland is damaged in the process. Radiation to the brain, head trauma, and brain metastasis are all things that can cause the pituitary gland to be damaged or destroyed. The way that pituitary hyposecretion is assessed involves assessing the hormones that are subject to pituitary control. So you look at the thyroid hormones, you look at FSH and LH, testosterone, estradiol, ACTH, prolactin levels, and growth hormone. Those are all hormones that are under the control of the pituitary gland, although for most of those there is something in between. For example, the thyroid hormone is actually secreted by the thyroid gland, but you have the TSH from the pituitary that tells the thyroid gland to release its hormone. So if you don't have TSH coming from the pituitary, then obviously you're not going to have the thyroid releasing its hormone. The same with the FSH and the LH. Those can be measured directly, but they'll also be responsible for estradiol levels and testosterone levels. Now, the IGF is another hormone. It's an insulin-like growth hormone, also called somatomedin C. It is more accurate of your mean plasma growth levels. Growth hormone is going to be growth hormone is going to be, it's got a circadian rhythm to it. So depending on what time of the day growth hormone is evaluated, it may vary. Versus the IGF-1, also called somatomedin C, that hormone is not subject to a circadian rhythm and actually tells you more about the constant growth level hormone that patient would have. Now, there are some stim tests that can be done. Okay, there's 3 different ones. The first one is an insulin stim test, and in order to do this stim test using insulin, they'll get a baseline level for the growth hormone, glucose, cortisol. Then they'll give insulin, IV, and they'll check blood draws at 30, 60, 90 minutes for those various hormones like growth hormone, glucose, cortisol. But they'll also do, AccuChecks or finger stick blood sugars every 15 to 30 minutes. They want the patient's blood sugar to drop to less than 40. I know that sounds scary. In order for effective testing, for the test to be properly evaluated. When the blood sugar drops that low, growth hormone should rise 2 to 3 times the baseline. That would be normal pituitary function. So if you bring a patient's blood sugar way down like that and their growth hormone does not go up, that is indicative of a pituitary hyposecretion problem. Another stim test that can be done is giving the Thyrotropin-Releasing Hormone. Okay, they administer that hormone IV, and then they measure TSH. If the TSH goes up, T3, T4 goes up, and that will evaluate the function of the pituitary gland. If you give TRH, remember that one comes from the hypothalamus, and there's something wrong with the pituitary, then the TSH will not go up. The TSH is your actual pituitary hormone, and then subsequently your T3 and T4 won't go up. We talked about that when we did the thyroid. Another is the Gonadotropin-Releasing Hormone. Gonadotropin-Releasing Hormone comes from the hypothalamus, and when you give that IV, you give that hormone IV, you should get LH and FSH going up. FSH and LH are your pituitary hormones. So those are some stim tests, and what you have there on that screen are the normal responses that those stim tests should produce. Now the MRI is going to be the exam of choice to produce a radiologic evaluation of the pituitary gland and the hypothalamus, and it's useful in identifying tumors. They may do skull films, not so useful anymore, but those would show enlargements or changes in the sella turcica. That's that bony area where your pituitary gland sits. Let's see. Now your clinical manifestations of hypopituitarism, the anterior hypopituitary symptoms. So a person with hypopituitarism has a deficiency of one or more of the anterior pituitary hormones. So a decreased production of all of the anterior pituitary hormones is very rare. Usually you'll have a significant decrease in one and a lesser decrease in the other hormones. The most common hormone deficiencies are going to be growth hormones and your gonadotropin hormones. So when we look at a deficiency in the gonadotropin hormones, you end up with things like sexual dysfunction, you end up with decreased libido, amenorrhea, impotence, infertility, and a decrease in secondary sex characteristics. So, the gonadotropin hormones, again, include your luteinizing hormone, that's LH, your follicle-stimulating hormone, that's FSH, and those hormones are supposed to stimulate your ovaries and your testes. So, anyway, we talked about those sexual dysfunction things. When growth hormone is affected, you see short stature in children and osteoporosis in adults. You'll see weakness. You'll see I got to look at something here. Growth hormone, also called somatotropin, has an effect on bone and soft tissue. Growth hormone has an indirect effect on your body tissues. That's probably a good place for me to stop. I'm at 9 minutes. I'll continue with this slide in a minute.